Hello. Good afternoon, everyone. Good afternoon, Professor. My name is Amina. Last name is Omotayo. I'm doing my video presentation about healthcare system in Japan. A little introduction about the healthcare system in Japan. What I found out was since Japan Health was founded in 1961, it has provided comprehensive coverage to all Japanese citizens. This can largely attribute to the universal health insurance system, thanks to the overall effectiveness of the system. The foundation of the Japanese health system insurance arose from an effort towards industrialization in favor of progress. The significant event in the history of employees' health insurance system was the enactment of the Health Insurance Act of 1922, which is promoted both by the government and industrial sector to provide health insurance in order to maintain the health of workers and prevent them from being attracted to socialism. More introduction about Japan healthcare system in 1930, by the mid 30s, the majority of employees already have access. In 1938, the central government decided to create an insurance system that targeted the unemployed population so as to provide 100% insurance coverage to all residents. And later, as the political agenda became influenced by the military, the Ministry of Health and Welfare further expanded coverage with main purpose of recruiting healthy soldiers during early 30s. However, CHI was offered on a voluntary basis, and there are still many people who are not covered either by employee health insurance or CHI. A little bit about their coverage. Government regulates nearly all aspects of the universal statutory health insurance system in Japan. The national and local government are required by law to ensure a system that efficiently provides good quality medical care to the citizen. National government set the SHIS fee schedules and gives subsidies to local government, insurers, and providers. It also established and enforced detailed regulation for insurers and providers. Japan 47 prefectures, that is the region, implement these regulations and develop regional healthcare delivery with their own budget and funds allocated by the national government. The SHIS comprises more than 3,400 insurers, provides universal primary coverage. Citizens are mandated to enroll in one of the SHIS plans based on age, employment status, or place of residence as residents, non-citizen, undocumented immigrants, and visitors are not covered. All SHIS plans provide the same benefit package, which determined by the national government, usually following a decision by the Central Social Insurance Medical Council, a governmental body, and so on. It does not cover corrective lenses unless recommended by a physician for children under age 9 or optometry service provided by non-physicians. There are some characteristics of Japanese health insurance system which include mandatory coverage for everyone. Enrollees have no choice of health insurance program if the enrollees is not head of a household and not eligible through his or her own employee, then the plan is dependent on the head of the household employee, employment status, age, and resident also. More characteristics in the next page, more characteristics on the next page, and also more characteristics. So we'll talk about the quality. Japan health system is distinctly characterized by universal health insurance, which provide excellent health outcomes at a relatively low cost at equal equity. In the past 5 decades, Japan has achieved a large number of health success. You see more about the quality. The cost. Patient co-payment for medical expenses must be paid at every visit to clinics and hospitals. All enrollees have to pay 30% co-insurance for services and goods received except for children up to age 6. Also more costs. The choices. There are 2 main types of health insurance in Japan. The employee health insurance system and national health insurance. The employee health insurance system is provided by employee workers, while the NHI is designed for self-unemployed people. Also, the references where I've seen it is also stated in there. I hope you guys find this PowerPoint interesting and more educated. If you have any questions, any concern, please email me back or send me a text or send me a message down below. Thank you.